What if your body has been warning you about diabetes, but you didn't recognize the signs? Many people live with diabetes for months or even years before they are diagnosed. In this video, we'll explore 10 early signs of diabetes that you should never ignore. Diabetes develops when the body cannot properly control blood sugar levels. In the early stages, the symptoms can be mild and easy to overlook. Recognizing these warning signs early can help you seek medical advice sooner and reduce the risk of serious complications. Let's begin with the first sign. One of the earliest signs of diabetes is frequent urination. When blood sugar levels become too high, the kidneys work harder to remove the excess glucose through urine. As a result, you may find yourself visiting the bathroom much more often than usual, especially during the night. The third early sign of diabetes is increased hunger. Even after eating a full meal, you may still feel hungry. This happens because glucose remains in the bloodstream instead of entering the body's cells to provide energy. As a result, the cells keep signaling that they need more fuel, making you feel hungry more often than usual. Another early sign of diabetes is unexplained weight loss. Even if you're eating normally or eating more than usual, you may still lose weight without trying. This happens because the body cannot use glucose properly for energy. Instead, it begins to break down stored fat and muscle for fuel, leading to gradual weight loss. If you notice unexpected weight loss, it's important to speak with a healthcare professional. Constant fatigue is another early warning sign of diabetes. You may feel tired or weak even after getting enough sleep. This happens because your body's cells cannot use glucose efficiently for energy. As a result, you may find it difficult to concentrate, complete daily tasks, or stay physically active. If this tiredness continues along with other symptoms, it is important to seek medical advice. Blurred vision is another early sign of diabetes that should never be ignored. High blood sugar levels can cause changes in the fluid inside the eyes, making it difficult to focus clearly. You may notice that your vision becomes blurry, or that reading and seeing distant objects is more difficult than usual. If blurred vision develops suddenly or continues, it's important to have your eyes and blood sugar checked by a healthcare professional. Another warning sign of diabetes is slow healing wounds. High blood sugar can damage blood vessels and reduce blood flow, making it harder for the body to repair cuts, scrapes, or other injuries. Even a small wound may take much longer than expected to heal. If you notice that cuts or sores are healing slowly, it's important to speak with a healthcare professional and have your blood sugar checked. Frequent infections can also be an early sign of diabetes. High blood sugar can weaken the immune system, making it harder for the body to fight bacteria and other germs. As a result, some people may experience repeated skin infections, urinary tract infections, or gum infections. If infections keep returning or take longer than usual to heal, it's important to consult a healthcare professional. Tingling or numbness in the hands and feet is another warning sign of diabetes. High blood sugar can damage the nerves over time, reducing normal sensation. You may notice a tingling feeling, numbness, or a burning sensation, especially in your feet or fingertips. If these symptoms continue or become worse, it's important to seek medical advice, as early treatment can help reduce the risk of further nerve damage. The 10th early sign of diabetes is the appearance of dark, velvety patches of skin, a condition known as acanthosis. These patches often develop on the neck, under the arms, or in other skin folds. They are commonly linked to insulin resistance, especially in people with type 2 diabetes. While these skin changes are not usually painful, they should not be ignored because they may be an early warning sign that your body is struggling to control blood sugar. These 10 early signs don't always mean a person has diabetes, but they should never be ignored. If you notice one or more of these symptoms, speak with a qualified healthcare professional and consider getting your blood sugar checked. Early diagnosis can make a big difference. If you found this video helpful, please like, subscribe to Better Health Today, and turn on notifications for more trusted health information.